I know President Obama kind of tipped his hat a little bit too to being open to some conversation about this, and I think it's doable. I think this is something that we can do, and I hope we do, because I don't think any one issue is big enough to prevent health care reform from happening. It's just too important.
Is Paul Rainey with us? Paul, would you go to the microphone, please? Paul was retired from Youngstown. He thinks that health care is too expensive, and he thinks that tort reform should be included in the health care reform. Paul?
Yes, Congressman. We just spoke a little bit about preventive medicine. Wouldn't it be quicker and simpler to fix that than passing health care reform?
Well, different studies have said that medical malpractice, it has some impact on cost, but more about maybe, it's hard to quantify what defensive medicine is. It's hard to get your finger on how many tests a certain doc does, but I don't think you're going to find the level of savings in the healthcare system just by doing tort reform. I think it's just too complicated to say, well, there's one silver bullet here that's going to just make everything else go away.
I understand that. Wouldn't it be simpler? Wouldn't that reform be simpler than health care reform?
Well, nothing's simple in Washington, let me tell you.
Nothing's
simple. So it will be, I think it will be, end up being a part of all this, you know, and is it simpler on its own rather than dealing with the whole system? Yeah, probably is, but all of these issues get kind of dicey as we go through them. That's why it's taken a while. That's why this has been going on since, you know, Teddy Roosevelt, and then Franklin Roosevelt, and then, you know, we've been going through this because it's so complicated, and there's so many, you know, nuances to this process. So I think tort reform will end up being a piece of it, and it's something that I think needs to be included.
Could I ask you one other question?
Ask him. He's the boss.
You made a comment about the tremendous increase y'all gave to the VA. I get treatment at the VA, and I thank God for that. But why do we pay more for a prescription at the VA than those horrible business people charge out there in the open market?
Well, part of the, just in general with the VA structure, although we did make this tremendous increase, we have tremendous pressure being put on the VA because of our returned soldiers who are coming back from Iraq and Afghanistan. So
This was before Iraq.
Well, it's difficult to keep up. I can't speak specifically to your, I know veterans health care is better than a lot of people get. I'm sure it's not perfect, but if you have a
no complaints about it.
Okay.
I just wonder why we have to pay more than for some prescriptions than there is on the open market.
What's your copay?
$8 a month. Walmart advertises $4 a month every day.
All right, well, we'll get to work on that.
Thank you, Paul. Question I have, and I think Paul alluded to it, was, you know, in the debate on healthcare reform and healthcare insurance reform, just about everything we've heard up to this point has been one plan to fix it all. Is that the right approach we need to be thinking, or is there anything wrong with thinking about let's fix one thing at a time, as opposed to an all-encompassing omnibus bill that is all or nothing?
Well, it's gotten whittled down, I think, from where it originally started. So I think the legislative process usually begins where you talk about everything that you possibly need to do in healthcare reform or any other piece of legislation. And then it goes through the committee process and slowly gets whittled down to something that everyone can kind of get their arms around and what makes sense. The problem is with healthcare is that there's so many different things that need to get done. We need to address pre-existing conditions. We need to address liability. We need to address reimbursements. We need to address universal coverage because we're dumping people into our emergency rooms and it's costing hospitals a lot of money. So you can go right through the line here: Medicare, Medicaid, Medicare Part D with the prescription drugs. I mean, there's so many issues here that there are some fundamental reforms, I think, that we want to achieve with this reform bill that we're pushing here. And I think if you don't take care of some fundamental things, you're not going to be able to bend the cost curve. And the key here is bending the cost curve. We have healthcare costs are growing at 9%. Okay, our GDP is growing at 3%. So you start playing that out for 10 more years, 1 out of every 5, and this is the chart here, by 2018, you see the graph, this is national healthcare spending as part of the GDP. By 2018, 20%, 1 out of every $5 we spend in this country will be spent on healthcare. You take that out another 20 years, 1 out of every $3 is going to be spent on healthcare. That is unsustainable for us as a country. Unsustainable. It will collapse our economy. It's already having tremendous effects. So if we don't have a reform bill that helps bend that cost curve a little bit, reduce the cost for small business, reduce the cost for families, then it's really not worth doing. I mean, it would have some benefit, but overall, it wouldn't do what we needed to do.
A piecemeal approach to healthcare reform won't fly.
I don't think so. I mean, we've got some fundamental things we need to take care of, and I think this is our time, and we can't shy away from this. Yes, it's big. This is a big deal. This is healthcare reform in the United States of America, but we can't be afraid of it. We've got to do this. This again, it's unsustainable for us to continue to go down this same road. If we do nothing, a family of 4 next year will pay $1,800 a year more in health insurance. And then the next year, you'll pay another $1,800 or $2,000. And then the next year, this is compounding. This isn't, it's $1,800 and it goes away. This just keeps adding up and adding up and adding up. And so if you have insurance now, and you're lucky enough to where your employer says, I'll pay 90, you pay 10, or I'll pay 80, you pay 20. That ain't going on forever. They're going to start, and people have already felt this, they're going to start coming to you. I don't want to get too much into the charts, but if you look there's been a 119% increase in what employers have had to contribute since 1999. So if they're not passing it on to you yet, they're still eating the cost. And we need small businesses to not be spending so much money on healthcare. We want them reinvesting back into their business, hiring people, buying a new machine, investing in the new technology, training their workers, giving their workers higher wages. This has been part of the problem why wages have been stagnant over the last decade or so, because healthcare has been eating up so much. So we've got to have a reform that bends that cost curve and allows these businesses to reinvest back into their own businesses and their workers.
We're going to go back to our audience now. John Breedlove, if you're here, would you go to the microphone, please? John's a college student from Austintown. John thinks that Medicare and Medicaid are disasters waiting to bankrupt America, and the government has a track record of making things more involved. I'm not sure what it says.
Okay, I was going to start off with a quote by Milton Friedman, but I think on this.
Well, we know where you're coming from now. We know where you're coming from.
If you put the federal government in charge of the Sahara Desert, there would be a shortage of sand within 5 years. History has proven this assessment of the government correct, as the government's solutions create tomorrow's problems. Today, for example, few from my generation believe that they're going to get any payment from Social Security. Medicare is bankrupt, and basically everything that you propose is a burden on my generation. So, what would cause you to actually believe that the government can be, the engine for solutions rather than the free market?
Well, first let me say that those of you who know Milton Friedman, he was pretty much responsible for the supply side economic policies that got us into the situation we're in economically in the first place. It was that philosophy that said, cut taxes on the wealthiest, people, and put a lot of money into defense spending, and everything else will take care of itself. Things will trickle down, and that's what we did during the last administration. And people ask, how are you going to pay for health care? The Bush tax cuts cost $2.5 trillion over 10 years. And what we're proposing here is $900 billion over 10 years. So we have